Health Minister Maria Caulfield is with us this morning, former nurse as well. I wondered what, just before we get on to vaping, I wonder what you thought about somebody who is a medic, presumably, trying to access Kate's private medical records.
Yeah, well, obviously, I don't want to comment on the Princess of Wales because I respect her decision that she wants to remain private about her health. But just to reassure your viewers that these rules apply to all patients. So there are very strict rules about which patient notes you can access. You're only allowed to access the patient notes you're caring for and with their permission. And there's really strict rules. The Information Commissioner would take enforcement action against trusts or primary care practices, but also as individual practitioners, your regulatory body. So for me, it would be the NMC would take action as well. So it's pretty severe and it's pretty serious stuff to be accessing notes that you don't have permission to access.
So the London Clinic could be in a lot of trouble.
Well, also any individuals as well. And we are, as I receive yearly mandatory training and that information governance and the importance about not sharing notes because, you know, in some communities you may be looking after a neighbour, a friend, a relative. And it's really important that patients have confidence that only those people that are looking after them can see their medical notes.
Yeah, so, I mean, it's absolutely outrageous, really, isn't it?
Yeah, it would be very disappointing. And I know there isn't
very disappointing, is it?
Yeah, I mean...
politics speak, if I may say.
Well, it would. You know, from a health perspective, it's not acceptable to be looking at people's notes, but it has been spotted and action has been taken. So people can be reassured that if it does happen, particularly with electronic notes these days, it's spotted pretty quickly if someone's accessing notes that they shouldn't be.
Talk to me about vaping. Who would have thought that vaping could be as bad for you as smoking?
Well, we don't know that as yet, but we have always been clear that we don't know the long-term side effects of vaping. And our mantra has always been, if you don't smoke, don't vape, and children should never vape. And the legislation that we're bringing forward around stopping the people smoking from those who are 15 and under who will never be able to legally buy cigarettes and tobacco products also includes closing that loophole on vaping for children, because currently children can't buy vaping products that contain nicotine, but they can buy flavoured vapes that are nicotine-free. And we want to close that loophole to end that trend where they're being sold almost like sweets on counters with different flavours, different packaging. So we want to close that loophole because we're not 100% certain about the long-term effects. We do know it's better than smoking. So for people who are trying to quit smoking, it is a help to get people off cigarettes. But we certainly do not want people who've never smoked to start vaping as an independent practice.
Although, am I not reading in the paper this morning, according to the latest study, that cheek cells tested in someone's mouth have the same sort of deformity as that's not the correct terminology.
Yeah, so there's some cell changes that would be similar to what you would see in people who smoke. We don't know if that then goes on to cause damage such as cancer or changes to heart tissue for heart disease and that sort of thing. We do need...
Can't be a good thing, though.
No, absolutely. And we've always been very honest that we don't know the long-term effects of vaping and we certainly don't encourage people to vape. And it's really a practice to help people get off cigarettes and tobacco products. And that's why we, we don't encourage people who've never smoked to suddenly start vaping. It's something we're going to be keeping a very close eye on, and the Chief Medical Officer obviously is very clear with that message. It does help people come off cigarettes, and we know that cigarettes and tobacco products, roughly about 80,000 people a year die from smoking-related illnesses, and that has to be our priority. That's why we're bringing in this legislation. So for those aged 15 and under, they will no longer be able to legally buy tobacco products, so we have a smoke-free generation coming through.
Does that include vaping?
That will include vaping for children. So under 18s will no longer be able to buy the non-nicotine types of vaping, but vaping will still be available because we recognise...
Is that the right decision?
Well, at the moment, we recognise it helps people get off tobacco and cigarettes.
Patch on, though?
You can, but we haven't seen the same dramatic shift in people stopping smoking as we have with vaping. It does have a significant impact on reducing the number of people who are smoking. That is our priority. You know, when it's taking 80,000 people a year from smoking-related deaths, that doesn't even touch the people who are ill with cigarette-related illnesses or families impacted by those people who are ill or who have died.
Apparently £17 billion a year is how much smoking costs.
Yeah. So there is always the narrative, oh, you don't want to stop people smoking because it brings in revenue. It does. It brings in 10 billion, but it actually costs us £17 billion a year in smoking-related impacts. So we want people to stop smoking, firstly because it will improve people's health, but secondly it does have a cost to the whole of society, whether that's inhaling other people's smoke or whether that's losing a loved one because they've smoked and it's impacted on their health. So this groundbreaking legislation, it's the single biggest intervention in public health we will ever see. That the next generation coming through will never be able to legally smoke because they won't be able to buy the products in the first place.
And when will you decide whether vaping should be included in that as well?
So the vaping will be included for children.
Yeah, but
in
more
terms
generally.
of, so we need to see the evidence, and what we don't want to do is ban something that is helping people getting off the most dangerous products, which is cigarettes and tobacco products. It is making a difference in terms of reducing the number of people smoking. We will see then numbers of people dying from heart disease and cancer falling. We are, working with the scientific community. We welcome this research that's being published today. It does show there's some changes. It doesn't show them what those changes lead to, and that's what we need to see. But if there is evidence that it's equivalent to tobacco or cigarettes, then obviously we will take action at that point as well.
In danger of becoming a nanny state when it comes to
Well,
smoking? And
there are some
vaping?
people making this argument. This isn't a smoking ban. So anyone who's smoking today or using tobacco will still be able to do so. This is about giving the next generation a chance never to start. We know.
Should there be a smoking ban?
I think, personally for me, it's people's choice. I think the evidence is pretty clear that smoking is not good for your health.
Have you ever smoked?
No, I've never smoked. My husband has smoked. He does vape now. So.
And have you told him what could potentially be happening?
If you had him on here this morning, you would know that and the only reason he stopped smoking was because he was able to go on to vape. So it does have a positive impact in getting people off the most harmful of substances.
But as you say, we don't know. Vaping could be just as dangerous.
No, well, we don't think it's as dangerous, but the evidence.
But we don't know.
But we don't know the long-term effects. In the short term, we don't see that change, but we don't know the long-term effects. And we're being honest with people. But people will still have the choice to smoke after this legislation has passed, even though they know the consequences of that. That is a personal decision for them. There is pretty rigorous legislation in place already for existing smokers. They can't smoke in pubs. We've raised the age of when you can buy cigarettes and tobacco. So we don't want to go that step further, but we don't want the next generation to face the problems of people who've been smoking, whether that's your teeth and the gum disease, or whether that's illnesses such as cancer and heart disease.
What are you going to say to your husband in order to make him to stop vaping?
I think I've given up on that one, to be honest.
Have you? So you're going to carry on vaping?
Well, I think, he finds it has stopped him smoking, and that's had a significant financial impact as well, because cigarettes are so expensive, whereas vaping is a much cheaper alternative. But the Chancellor did put tax on vaping products in the recent budget, because we recognise that if there is a cost to getting people off vapes, we need to factor that in as well. But the evidence at the moment is, in the short term, vaping is safer than smoking or tobacco products. But we are very, very watchful about the long-term data, and that's a global position as well.
When will you look at it again?
Well, we're constantly looking at it. The Chief Medical Officer is constantly looking at the new information that's coming through. There's lots of studies being done in this space, but also at an international level as well. All countries are watching on the data on vaping. But at the moment, our mantra is still, if you don't smoke, don't vape, and children should never vape.
OK, it's good to see you. He's never going to stop vaping then?
Well, my husband, I can't, I can do certain things in this world, but stopping my husband vaping...
You can look down that lens and tell him.
Stop vaping.
There you go. There you go. Thanks very much. It's good to see you, Maria. Thank you.